Good evening, everyone. Welcome to the SOS NHS Rally. It is so great to see so many of you on this call tonight. So the SOS NHS is a new coalition of campaign groups and trade unions that are demanding emergency funding for the NHS now. We're calling for the emergency funding of 20 billion to save lives this winter, to invest in a fully publicly owned NHS and guarantee free healthcare for future generations, and to pay staff properly. Without fair pay, staffing shortages will cost lives. Now, we have the backing of nearly 40 campaigns and unions, and our rally tonight has messages of support from Diane Abbott MP, Margaret Greenwood MP, Rosanna Allen Khan, the Shadow Minister for Mental Health, and also workers from Great Ormond Street Hospital who are struggling on the front line. Now, for those of you that don't know, I am Sonia Adesara. I am an NHS doctor and an activist, and I am chairing this event on behalf of Keep for NHS Public, which is an organisation I'm sure you all know has been campaigning for the past 17 years now against the privatisation and the underfunding of our NHS. And alongside me chairing this event is Kat Hobbs. I'll just let her introduce herself.
Hi, everyone. Thank you so much for being here this evening. I'm Kat Hobbs. I'm the director of We Own It. We campaign for public services for people, not profit, and it's great to be part of this campaign. Thank you for being here on a Wednesday evening to get fired up.
So just got a few announcements, a few housekeeping for tonight. If you need subtitles, they're available by clicking the CC button at the bottom of your screen. This meeting is going to be recorded and it will be live streamed onto our YouTube channel and our social media platforms. There'll be links to these social media platforms and lots of other links that are going to be posted throughout the evening on the chat, so keep an eye out on that. And we have an absolutely brilliant lineup of speakers tonight from across the health movement and across the union movement. We do have a lot of speakers, so I'm going to be asking all the speakers to stick to 3 minutes, and me and Kat will be nudging you when you've got 30 seconds left. So...
Fantastic. Sorry, thank you. So just before we introduce our speakers, I'd just like to remind you to go to the new SOS NHS website at any point during this rally, sign the petition, make a donation. The address for the website is sosnhs.org, and you can look at the What You Can Do section to sign that petition and donate. And now I'm really pleased to announce our very first speaker is the amazing Nadia Whitton, who is a Labour MP for Nottingham East, and she is also used to be a care worker, so she really knows her stuff on all fronts. Over to you, Nadia.
Thank you so much, Kat and Sonia. Thank you for organising this incredible rally. I can see that we've got almost 500 people joining, and I'm sure that will only increase. Apologies, first off, because I've got to leave in about 15 minutes. But we all know that our NHS is in crisis. We can see it all around us, whether it's life-changing operations being postponed again and again, people dialing 999 being told to book a taxi because it will get there quicker than an ambulance, patients dying in the back of ambulances outside hospitals because there aren't any beds. And throughout the pandemic, it was NHS staff and care workers as well who have kept going so selflessly in order to save lives. But they've paid a heavy price for that. Burnout, long COVID, PTSD. It's estimated that about 1,000 have lost their lives. And of course, so many more will have passed COVID onto family members and friends who have then gone on to die. And all the while, these workers are struggling to make ends meet. It's no wonder that the latest figures show that a record number of NHS workers have left. But what is the government doing in all of that? Giving them a real terms pay cut, pushing through legislation to reorganise the NHS and to give private companies a seat at the table. It's insulting, and it's even more insulting that while the Tories are doing this, they're pretending to be pouring vast sums of money into the NHS to fix a crisis that they created. Because even before COVID, a decade of underfunding left our NHS on its knees. And the money that the government is now putting into the NHS just won't compensate for 10 years of brutal cuts. So we need emergency funding to stop our NHS from collapsing. And we need to stand shoulder to shoulder with health and care workers and demand that they receive a pay rise that they so thoroughly and urgently deserve. And of course, in the long term, we must fight for an NHS that is fully funded through progressive taxation, publicly owned, publicly run, for the benefit of patients and never for private shareholders. So keep our NHS public, and everyone in this rally, all the unions who are supporting this, have my full support, and let's unite together to save our incredible NHS.
Thank you so much, Nadia, and thank you for everything that you're doing in Parliament and wider supporting us in the health movement. So next up, we have Holly Johnson, who is an oncology nurse and an activist for NHS Workers Say No.
Thank you, Sonia. Frontline staff are demoralised, exhausted and feeling the pressure of an overwhelmed service that has been deliberately underfunded. It is definitely not business as usual. We are seeing one qualified nurse looking after whole wards, nurses being put in charge of wards of patients when they have been qualified not very long. We are seeing ambulances queuing to get into A&E, waiting for beds, waiting up to 12 hours to see a medic, ambulances unable to take patients to routine appointments, all whilst working through the ever-growing waiting lists. In my own area, we are seeing the impact of delayed diagnosis, investigations and treatment, meaning less treatment options and an increase in death. The patients we are looking after across the board in hospital are sick too, requiring expert interventions and hands-on care. We are seeing the closures of acute mental health beds for both children and adult services. We are seeing cuts to midwifery services that have led to it being critically unsafe for staff and patients. The staff that remain in the NHS are tired, overstretched, and looking at any way possible to leave. There are 100,000 vacancies in the NHS, 27,000 left between July and September last year, and we are set to lose 86,000 in the coming months due to mandatory vaccines. 40% of the workforce are close to retirement age, and there is no way we can backfill that amount of staff leaving and replace that type of experience. And what incentives do they have to stay? We need urgent prioritisation of retention and recruitment. For over a decade, the NHS workforce has faced a deliberate erosion of pay. Band 2 staff will be on below a living wage by April 2022, and half of the NHS are already on a minimum wage. Everyone's responsibilities and skills have grown without the pay to match, and this was before the pandemic. The 3% pay award does nothing to address the staffing crisis, with inflation now being at 7.1% and conditions worsening in the NHS. Staff will simply continue to leave. By not addressing pay fairly, it leaves the door wide open for private companies. Staff are already leaving to work for agencies for what look like better terms and conditions and better pay. We have a two-tier workforce right now. Areas of the NHS workforce have already been outsourced, such as security, domestic services, HR and portering. If there are no staff left in the NHS, there will be no NHS. We see the impact of this government's austerity measures across the public sector, across essential workers, and we see the impact of the austerity in terms of worsening health outcomes for the public, affecting those in the most deprived areas worst and hitting the working class and people of colour disproportionately. The anti-trade union laws are a stumbling block for workers defending their rights. We need to keep the pressure on in the unions and not let them hide behind the 50% threshold as an excuse to not act. We need to see bold leadership and build confidence amongst our workforce who desperately need to be fighting for ourselves, our patients and the future of the NHS. We need to see the unions working together and campaigns like SOS NHS building the fight. It is so important that campaigns like ours exist to keep the pressure on from below, but to work with the unions and to galvanise workers into action. NHS Workers Say No will continue to campaign around our demands for pay justice, which should be fully funded, for an immediate end to outsourcing and privatisation, the scrapping of the health and care bill, and for staff and patient safety. The NHS, its workforce, need the public behind us. We need its unions and for staff to fight for it. We need to unite as the working class to fight back and protect the NHS. Many of us have paid for this crisis with our physical and mental health and in our pay packets, whilst the government drinks champagne with their trums. We're running out of time and patients are suffering now. Thank you.
Thank you so much, Holly. Very powerful stuff. I'd now like to introduce Colenso Jarrett-Thorpe, who is the National Officer for Health at Unite the Union. Take it away, Colenso.
Good. Sorry.
Do we have Colenso?
Hello, good evening.
Good evening.
Everyone, it's lovely to see. Hi, Sonia, and thank you very much for inviting me here for today's rally. This is about NHS, saving our NHS, and we're all in it to win it. We're all here to do this, and I'm really pleased to be joined by such a fantastic panel. What I want to say is this is a long and hard road, and Unite is there for the long term for all of you. Unite wants to be leading the campaign with our fellow campaigning trade unions and our fellow campaign organisations in defending our NHS. And we have stepped up to the mark as a trade union in the fight against the Health and Social Care Act. We think the Health and Social Care Act is the biggest threat to the NHS in terms of privatisation and the continual marketisation of the NHS. And Unite has been campaigning vociferously against this act. Yes, there are some parts of the act that we welcome, like the scrapping of the Section 75, but really it's a pernicious threat to the NHS, and it further fragments and actually individualises and marketises the NHS in England. We are firmly of that belief, and will campaign for the end of this act till our last breaths. And we're with you on that campaign. We organised a rally on the 22nd of November in Parliament to make sure that we were against that campaign. We've been emailing our members. We've been asking our members to write to MPs. And we feel this act doesn't actually do much, really. It just arranges the deck chairs. In the NHS, there's still not a proper workforce plan. There's still not decent pay for our workers. There's still not enough funding to go into our key and critical services. That is actually, this is this is the wrong prescription for the NHS, and everyone knows it. And it's just rearranging the deck chairs so Boris Johnson and Rishi Sunak and their mates get further private sector interests into the NHS. I was lucky enough to ask Sajid Javid a question about this at one of our trade union meetings, and he still believes this is the right way forward. To be honest, he doesn't have a clue what he's talking about, and was just preparing some sort of script that one of the civil servants had prepared for him, because he's one of the chief privateers, Sajid Javid. He actually worked for an investment bank, and probably the interest of him and a lot of his peer group aren't that, because Tories are very disarming. They're very nice and very polite, but they have an agenda, and we think that agenda is going to be fulfilled through that act. So we're going to campaign vociferously against it, and we had a fantastic meeting with the Lords last week, and we were lucky enough to have John Hendy has helped us lodge an amendment against the act that is there to protect workers' rights. Because something we won't accept is whatever happens with ICSs, we won't accept workers' rights being undermined, and we won't accept that when they transfer, they'll be transferred out of agenda for change terms and conditions, which all the trade unions have fought vociferously for. So we won't accept that, and we'll make sure we continue to fight for workers' terms and conditions and a decent NHS with our fellow trade unions. And that's something that we will see and will continue to support as we go through this campaign. Well, also, I heard what Holly was saying. Unions have always been working together. I can see my colleague Sarah Gorton, who I've been working with for the past. I've seen Sarah more often than my own family over the past 2 years. So Sarah and I have been working very well together in trying to ensure that we protect workers' rights and we protect NHS pay. All right, it's not always gone the way some people would like it to do, but trade unions are actually working really hard to try and make sure we represent our workers, and we're trapped, completely trapped by the NHS PRB, which is the pay review body. So we're doing our best within that system to ensure that we can hear the voice of working people and that we continue to ask for a decent and proper pay rise that respects that there is a cost of living crisis and does something to actually stem the flow of NHS workers outside the NHS to leave the NHS, and that we fight the recruitment and retention battle that there is there. So thank you very much. Unite is there with you. We're campaigning to make sure we end this pernicious bill or reform it as much as we can, and we'll always be there to make sure our NHS is free at the point of entry, releases the shackles of privatisation and marketisation. And also, that I can see Barry Gardner and Nadia there, you've got to remind West Streeting and the front bench that in the NHS in England is nothing like in Scotland and Wales, which was the political party that brought the NHS in Scotland and Wales and stopped it being privatised and sold off to the market. Can you tell me what political party that did that? You're a bit silent, no, all of you. It was the Labour Party in Scotland and Wales that did that, and they need to do the same in England. So Unite will be campaigning to make sure the Labour Party doesn't go down the road of privatisation, marketisation, and more markets and division within the NHS. It has to stop. It stops here and it stops now, and the Labour Party can do something about it. Good night.
Thanks, Colenso. Very well said. And thank you, Colenso, for, as NHS workers, you've been supporting us for many years. It is so great that we have the trade union movement within this campaign supporting us. So thank you, Colenso. And next up, we have another giant of the trade union movement. It's Sarah Gorton, who is Head of Health for Unison. Thanks, Sarah.
Thanks very much, Sonia. And as Colenso said, yeah, we've spent a lot of time together, and you'll know that I've heard that speech from Colenso several times over the last few months. So thank you ever so much for inviting me to speak. And as Head of Health for Unison, I couldn't be more proud of the work that our health and care members have done over the last 2 years, and work that they continue to do against the odds, and where it feels increasingly like changes to public health measures aren't so much data driven as a bid for political survival. So in a rare and very welcome moment of positivity last autumn, I had the great pleasure of interviewing author Michael Rosen about his experience of being in hospital with COVID last year and the book that he wrote about it. And the book's called Many Different Kinds of Love, and it describes interactions that he had with a wide range of clinicians and support workers during the treatment that he received. And in it, the compassion of those staff is evident. And Michael talked to us about the impact that had, not just on his physical status, but on his sense of self and his determination to recover. So whether we are the patient or client receiving treatment, the health worker delivering it, or the family member observing it, we should all be able to expect that same standard, that health and care should be delivered proficiently, to a high quality and with compassion. And it's this that's being drained from our services, eroded by a decade of underfunding, depleted by disinvestment in training and staff pay, and now pushed to the brink by the competing demands of the pandemic, the massive backlog, and now the wrong-headed vaccine mandate. And the danger is that we'll have a service that's stripped of compassion, stripped of the time to do tasks properly, a safe number of staff, and minimum times for people waiting in physical or mental pain for treatment and surgery. So our health workers always tell us that being able to do a good job really matters to them. As Omicron was starting to spread, almost half of our Unison health workers told us they were going home after every shift, not just exhausted, but really deeply worried about the quality of the work they'd been able to do that day. 3 in 10 of them said they were actively looking for work outside the NHS. So in stats like these, reports from unions, professional bodies, think tanks, parliamentary committees mean this problem is now too big and too widely acknowledged to ignore. And the government's now on notice to act now to prevent the current staffing crisis from becoming a permanent feature across the whole NHS, and to respond with a plan to increase funding and invest in staff, not simply to brazen it out, pretend it's all the result of the pandemic, and land the service with yet more unwanted reforms and pressure on those who can afford to go private, not just to party on and hope the public won't notice. We all deserve an NHS where those receiving care and treatment know that they can expect a good and a kind service, and where staff are able to work without constant fear, anxiety and pressure. So we're proud to support this coalition, the shared purpose of fighting for the best possible version of our National Health Service. And thank you very much.
Thank you so much, Sarah. That was very moving. Fantastic. I'd like to hand over now to Alison Treacher, sorry if I'm saying that wrong, who is the Secretary of the Care and Support Workers organisation, and she's also an activist with Unite. Over to you, Alison.
Thanks very much, Kat. I'd like to start by saying a massive thank you and solidarity to all the NHS workers on this call. And I'd like to publicly state that Care and Support Workers Organised support you in your struggle for better wages and terms and conditions. The systematic exploitation of care and support workers should not be a benchmark, and it should not start the race to the bottom. We see the worth and value of all health workers. We've relied on you throughout the pandemic, and we have nothing but our respect and our unwavering solidarity. We harbour the same anger as you, as we've both witnessed this government's contempt for working people. We stand alongside you while we all fight for better, not just for ourselves, but for our communities which are denied vital services. The NHS will not survive without the support of strong social care services, services which are provided by a respected and a well-remunerated workforce, a skilled workforce who have put their lives on the line during the pandemic, a workforce which has been insulted by pay freezes, shunned by the lack of recognition of our sacrifice, and demoralised by a white paper which prioritises the estates of the rich over providing quality support and ensuring a future for a sector we care so deeply about. Friends, I don't have long to speak about the complexities of the problem we face and the battles we have ahead. The health and care bill, the staffing crisis, the care deficit which leaves 1.4 million people without their basic needs being met, creeping financialisation, parasitic financialisation, and a workforce which is at breaking point. We all have a role to play. The health of our class is at stake, and we at Care and Support Workers Organised are ready for that fight back, ready to defend what we have whilst building for and demanding what we need. Nationally funded support services which are locally delivered, a service which works in cooperation with the NHS, guided by co-production of workers and users of support services, a service which ensures the right of independent living and choice and control aren't just buzzwords, a service which is designed to meet the needs of people, not for the creation of profit. There is so much experience on this platform, and it's a real honour to be alongside some of the activists. There is so much power in our movement, so let's focus that power and take back what's ours, our NHS. Thanks very much.
Thank you so much. Thanks so much, Alison, for your support. So as I said at the start, I'm chairing this event today on behalf of Keeper NHS Public. Keeper NHS Public has been busy campaigning on many fronts over the past couple of years. The People's COVID Inquiry, which I'm sure many of you have come across, has challenged the Met to investigate the government ministers for misconduct in public office. We are campaigning against the Health and Care Bill, which we totally oppose, as other speakers have said. And we're also fully behind this campaign for emergency funding for the NHS. Now, this is important not only to ensure that every person gets quality healthcare, as Sarah said, but it's also to ensure that to stop the current decline in the state of the NHS, because we know if the NHS continues to decline, more people will use private healthcare. That collective solidarity this country has for the NHS will disintegrate, and that will make it politically easier for privatisation to happen and allow the exploitation of sickness for profit. Now, our next speaker is someone, again, that needs no introduction. He has been campaigning against privatisation of our NHS. He is the encyclopedia of privatisation against our NHS. It is John Lister. He is he's the editor of Health Campaigns Together and co-editor of The Lockdown, and he is a fountain of knowledge. John Lister, over to you.
Thank you, Sonia. It's the lowdown, by the way, not the lockdown, but thank you very much for that very generous introduction. SOS NHS is the most ambitious ever campaign for the NHS. We're demanding 20 billion in extra spending. And we know it's a huge amount of money, but there's so much evidence to show why this much is needed. The real terms cuts in spending every year since 2010 have left an enormous financial hole to fill. NHS providers back in 2019 estimated that gap at £35 billion a year. 20 billion is just half of that, although we're just asking after a one-off payment at this point, a down payment. But it would allow the NHS to invest in restoring and expanding capacity, repairing and rebuilding dilapidated hospitals, replacing clapped-out equipment, reopening the 5,000 acute beds still closed since the COVID pandemic struck, investing in mental health with new buildings and staff. It would also fully fund last year's miserable 3% pay award and fund a pay increase to help retain and recruit the staff we need, as people have been referring to earlier, and enough to rebuild public health services to take over test and trace as a public service and help tackle growing health inequalities. Of course, Rishi Sunak will reject the demand and claim it's unaffordable, but we know that's not true. We know he happily threw £47 billion into the bounce back loans for small businesses and hasn't bothered that more than half of it seems to have been stolen or lost. We know ministers happily squandered billions on dodgy, secretive PPE contracts with their mates and upwards of 17 billion on disastrous privatised test and trace. They wasted £2 billion in 2020 on paying for private hospitals for bed space that was hardly used, and up to £10 billion is put aside to do more of the same for the next 4 years. Now Sajid Javid has ordered NHS bosses to sign yet another wasteful deal with private hospitals. So if the money like this can be raised to waste, it can be raised to invest. Sunak's spending review locks in underfunding until 2025. We can't accept that. We need to give NHS staff hope that things will get better, that they will be rewarded for the superhuman effort so many have put in fighting COVID and running services day to day. We need to convince patients and the public that the NHS can recover from the 6 million plus waiting lists, patients dying in ambulances outside hospitals, and huge delays in mental health treatment. Of course, funding is far from the only thing we need to fight for in defending our NHS. But without more investment in the NHS, the private sector will entrench itself further still. And without more money, there is no answer to the NHS staff shortages. SOS NHS is now leading that fight on these issues. This rally is just the beginning. Let's make sure now we go and build a movement so massive, loud and strong, the Tories can't ignore us. Let's be heard in every town and city. Let's get friends, family, work colleagues, councillors and MPs on the case. 35 years ago, a campaign that was nowhere near as strong as this forced the Thatcher government to increase spending. We can do better than that now. We have to. Remember, we've only got one NHS and it's time to fight for its life. So even if we can't kick them out, let's kick this weak, corrupt, despicable government into another U-turn. £20 billion now.
Amazing. Thank you, John. That's absolutely a fantastic speech and so inspiring. And thank you for doing so much towards the blueprint of what is needed and putting that on this new site. So just a reminder for people, if what John's just said makes you angry, makes you frustrated, makes you fired up to campaign, go to sosnhs.org, sign the petition, make a donation, and let's make this huge. I'd now like to introduce Dr. Helen Salisbury, who is an NHS GP and a member of Independent Sage and a fantastic campaigner.
Hello, everyone. John's just stole half my lines. I think there's nothing else to say. I want to talk about COVID as a tragedy in all sorts of ways, a tragedy for patients and families and for workers, but also such a wasted opportunity. There was huge investment during COVID in health. Unfortunately, it didn't go into the NHS. So it's not inevitable what happened. We could have been better prepared, but we weren't. And when it did happen, we could have spent the money that was spent in the NHS, leaving a lasting legacy. If the money that had been spent in test and trace, for example, had been spent increasing laboratory capacity within the NHS, in improving the contact tracing services we already had within sexual health and other parts of the NHS, we could have built on the expertise we had. We could have done a good job. We could have done a better job, saved more lives, and had really, really good NHS services at the end of it. But that didn't happen because the money got sent somewhere else to commercial outfits who did the job really, really badly. And I could go on about that topic for a long time, but I won't. I suppose there is some good news that we learnt, in that it's very, very clear that lack of money overall isn't the problem, okay? Because there was 35 billion to throw at test and trace. There is 4.3 billion to just not really bother that it went on fraudulent loans. So actually, clearly money itself isn't the problem, it's political will. Okay, and I do think we need to make sure that everybody understands that when people say we can't afford it. No, that's rubbish. Of course we can afford it. And if you're going to decide what you'd like to afford, which thing comes first? Clearly, people's health and well-being comes first, doesn't it? If you had to decide within your own family what comes first, health should come first. But we have a system that over very, very many years has decided, actually, it's not that important. And that's just silly, really, isn't it? Because if you want an economically active population, you've got to keep them well. If you spend money on health, the people who are helped by that are able to work and live happy lives, and actually an awful lot of money you might spend may prevent them getting more ill. You also, when you spend money on health, you spend it in wages to people who then go and spend their money. It doesn't disappear to the Cayman Islands, it stays in your economy, and that is a really good way of spending money. We need to be investing more in our NHS because it's the right thing to do for patients, and it's the right thing to do for staff. And what else should we be spending the money on? I really don't think it should be going to all the fraudulent companies that the Tory government seem to like sending it to. I want to talk just a tiny bit about general practice as well, because I think there's almost an acceptance that services have got worse inevitably, and they'll inevitably get worse. And I do think we need to fight against that and say, no, we can have a good service. We can have a proper NHS. There aren't enough GPs, it's true. We need to train some more. We need to treat them better so they stay. Actually, there's lots of other people coming into general practice to help us. There's pharmacists and physios and paramedics are all working in general practice as well, which is fantastic when they come in addition to rather than instead of GPs. And that's, oh, sorry, my light's just gone off. I've been still for too long. One of the reasons why we really need to fight against the privatisation of general practice services is that if you have a private company taking over and holding the contracts, one of the first things they do is, rather than have all those additional staff as additions, they have them instead of GPs because they're cheaper. Yeah. And for me, one of the main things is trying to keep general practice out of the hands of the private sector, because inevitably, if it's in the private sector, there will be a conflict between providing that best service for patients and providing the return to your shareholders. And both of those are duties on private companies. They have to do both of those things. And now it's too dark to read my notes, so I think I'm going to stop there. But I think there's everything to play for, because the money is there. We just have to change the politics so that the money goes where it's needed.
Thanks so much. Thank you so much, Helen. You make so much sense. Who's voting for Helen to become Health Secretary? I've actually been reading Helen's articles in the British Medical Journal for many, many years. So I'd recommend you read her articles if you want a common sense approach to what we should be doing in the NHS. But thank you very much. And Helen mentioned the risks of private companies taking over our general practices, and it's a huge risk. We know it's happening. I'm sure many of you know about Centene, which is a US corporation that is currently trying to take over London AT medical practices, that's GP practices in London. And there is a judicial review against the Centene takeover of London AT medical practices that's going to be held on the 1st and the 2nd of February. So, you know, I would, if anyone can, please come and support that. We're doing it. We will be attending both those days. We'll be assembling at 9 a.m. on Tuesday, 1st of February, and Wednesday, 2nd of February, outside Royal Courts of Justice in the Strand, London, postcode WC2A2LL. And let's just get out there, be loud, and make some support. And we need to really stop this private takeover of our general practices happening, because of all the reasons that Helen said. So next up, we have another member of the trade union movement with us today. It is Steve North from Unison. So Steve is the Salford City Unison branch secretary and on the NEC representative for Unison. And he pioneered huge pay and conditions deal for the social care workers locally. So well done, Steve, over to you.
Thank you, Chair, and thank you for inviting me to speak tonight. And thank you to everyone on the call tonight who works in health or social care or who fights in campaigns for the health and social care services we deserve. Thank you to everybody who's involved in this struggle. And it does often feel like a struggle, but there are pockets of light, there are victories possible, and hopefully what I'm able to bring tonight is a sense of how those things can be achieved. So prior to becoming a full-time seconded officer, I'm a lay member of Unison. Prior to that, I worked as a mental health support worker in a community mental health team. So I was a local government employee, but I worked alongside NHS employees. And I saw firsthand the importance of health and social care working together. And we've seen through the pandemic the consequences for the NHS when social care is not properly funded, when social care is fragmented, when social care is dominated by the market and the poor practices that Ali set out previously. At the start of the pandemic in Salford, where I work and where I live, we were hit with the anxiety and the fear that care workers were facing as a consequence of the spreading of COVID very quickly into care homes, the worry that they had working for largely private employers in many cases, that if they became sick with COVID or they had to isolate or they had family members who were shielding and they weren't able to come into work, they would lose a lot. They would lose a lot of money. They don't have a lot of money to start with, but what little money that they were getting paid, they would lose to be replaced by statutory sick pay. And you can imagine the pain and concern that this caused for people. I'll give you one example. On the first night of Clap for Carers, I wasn't able to join in with Clap for Carers because I was on the phone to a care worker who was in tears because she thought she had COVID, would need to come away from work, and didn't know how she was going to support her family. So these are the things we were dealing with. Now, very quickly, through organising work we've done in social care prior to the pandemic, we were able to mobilise workers and strike a deal with Salford City Council and the NHS locally to put in place what was called the Salford offer, which ensured that any care worker, support worker, regardless of who they worked for, who needed time away from work for COVID-related reasons, would receive full pay at the normal hourly rate, not just a contractual rate, because many care workers, as I'm sure you know, work well beyond their contractual hours in order to make ends meet, would be paid at their usual rate for the job. And that brought a lot of security to people at that time. Shockingly, despite the fact that the public purse offered to pay for this money, we had care providers in Salford who were not prepared to implement it. No cost to them, but they were not prepared to implement it. And the reason that we were given is, if we do it in Salford, we'll have to do it elsewhere. We can't afford to do it in elsewhere, so we'll have to explain to workers in Manchester, Bolton, wherever, that we're not going to do it for them. That's the mentality of the profit system that we need to overcome. We challenged those providers, but we didn't just want to fight a reactive battle in terms of getting the Salford offer secure. We wanted to go further and ensure that wages were uplifted for care workers in a way that they deserved. One company we targeted in particular was Anchor Hanover, a large company, largest specialist provider of care for elderly people in England. And that culminated in December this year with us securing a commitment from a company that hadn't even been prepared to implement the Salford offer previously, to implement the real living wage, still not good enough, but a significant increase for a lot of those workers, for all of their workers, not just in Salford, nationally, adding £19 million to their pay bill overnight as a result of organising care workers, political campaigning, working with civil society and putting pressure on. So these sorts of victories are possible. We have to, as trade unions, organising social care. Yes, it can be difficult, but that's not an excuse not to do it. If we can build and organise in social care, not only will we help those who work in and rely on care, it will assist the NHS as well. A lot of the problems the NHS are facing is because of inadequate social care in this country. So solidarity with all of you. You know, victories are possible. We can win this if we stick together and fight the services that work for the people who work in them, but also the people who receive them as well. So solidarity, everybody. We're now going to embark on a big insourcing campaign in Salford. That's where we go next. And that's what we need to be fighting for in social care as well. So good luck with all of your campaigns, and let's continue to work together. Thank you.
Thank you, Steve. Solidarity, congratulations on your victory, and thank you for reminding us that we can win. I'd now like to introduce Ariel Mamana, who is a paramedic and is also the Equality and Diversity Lead at GMB.
Hello, thank you for inviting me to represent my colleagues from the NHS ambulance sector. My colleagues have been working tirelessly providing uninterrupted emergency and urgent care throughout the pandemic with commendable dedication and compassion. So we feel that now is time that compassion and due care is equally reciprocated. The increasing cost of living is having a major impact to the wages. They deserve a true pay rise that keeps us with inflation. In real terms, all they have received so far is a pay cut. So by looking after our NHS workforce, we look after our patients and service users. My colleagues, at the moment, they feel stressed and demoralised due to working long hours, frequently without a break, and having to attend to incidents that at times have been waiting for hours. They feel saddened that many people in our communities cannot have the outstanding quality of care our NHS has always provided. So we must stand up for the NHS and its values. Those values are part of the core structure of our society, where everyone is equally and fairly treated. These are our people promise. It's in our contracts, our ethics. We are against the privatisation of the NHS. We want and need more funding to keep us with change of times and to save us and protect us from any future pandemics. We need more funding for prevention campaigns and education programmes. We require support for recruitment across the NHS, and equally need to stop with the hostile environment that those who have come to this country to work, many of whom work for the NHS and are our colleagues. Staff shortages are an increasing problem that affects the entire NHS. We need leaders, but real ones. The NHS needs a vision that keeps us united and not divided. We will always remember fellow NHS colleagues who lost their lives during the pandemic whilst doing their job. We will remember them. Thank you.
Thank you so much. Yeah, I think, you know, many of us will know, will have colleagues that did lose their lives during the pandemic. So thank you for reminding us of that. And it's something that we will compete. You know, we cannot forget. A date for your diaries. Please get your diaries out. It's the next SOS NHS event, and it's a national day of action on Saturday, 26th of February. So we will be holding events around the country in town centres, in shopping areas, outside hospitals, and we are calling on local campaign groups, union branches, NHS staff and community organisations to get involved. So please have a look at the website sosnhs.org for more information, and you can sign up to our newsletter so you know what's happening. But please get involved in that date, and that's Saturday, 26th of February. Have a look at the chat for more information. Now, next up, we have another another giant of the trade union movement. She is also a fierce, kick-ass feminist. It is Shaun Elliot. She is the Women's Equality Policy Officer for the TUC, and she is brilliant. So take it away, Shaun.
Thank you, Sonia. And I'm now the Senior Policy Officer heading up the Public Services team at the TUC. And so I'm really delighted to be here tonight. Thank you so much to you and Kat, to the organisations behind the SOS NHS campaign, and to my fellow panellists. It's a really tough act to follow, but incredibly motivating. We find ourselves here tonight, 11 years into a Conservative government, in the midst of a record-breaking cost of living crisis that our workers in the health system are at the sharp end of. And that crisis has been brought about by a decade of government-imposed public sector pay restraint that has robbed our NHS workforce of their hard-earned wages. As inflation and tax have been driven upwards, their pay has been kept down. And as Helen touched on earlier, that harms all of us. But what does it tell our NHS workforce? It tells them that they aren't valued. It says your living standards don't matter, but they do. And that is why everyone is here tonight, to express and to show that solidarity with the NHS workforce. And it's why the TUC has been working hard with our affiliated unions to win NHS workers and all those working in social care and across our public sectors, all of those key workers on the front line. We need this year to win them a significant and early pay rise, one that, exactly as Ariel says, keeps pace with the cost of living. Because TUC did an analysis last year, and we found that many NHS workers were taking home during the pandemic less in their pay than they were in 2010. Porters working in hospitals, their pay was down by around £920. Nurses and community nurses' pay down by as much as £2,715 a year. Midwives, radiographers, paramedics, their pay down by as much as £3,500. We produced a briefing recently that we sent to every MP in the country, highlighting the recruitment and retention crisis facing the NHS. But we told them that the workforce problems that the NHS has faced this winter aren't born of the COVID-19 pandemic alone. They are born from many of the problems we've talked about here tonight: a decade of underfunding, privatisation, marketisation, botched reforms and mismanaged change. And importantly, the outsourcing of key jobs in the NHS that have led to mistreatment of our NHS workers. All deliberate choices by this government. Excuse me. Before we sent the briefing to MPs, we spoke to our union members across the NHS, and something one cleaner working in a hospital in London told me really stuck with me, and I wanted to share it. My wage doesn't stretch as far now. When I go to the shops, I have a choice. Do I pay my bills? Do I buy food? I have to think about whether I can keep my heating on this winter. It's a really scary place. No one working in our NHS should be faced with those choices. It's no wonder we're facing a staffing crisis. In September 2021, NHS England was operating short of almost 100,000 staff due to unfilled vacancies. And that puts huge pressure on those remaining who are trying to attend to the day-to-day care and running of our health system. And with vacancies as high as they are, with more staff looking to either retire or to leave the workforce, can the government expect us to think they really have a plan to clear the backlog when they don't have the staff to do it? The Health and Commons Select Committee recently published its report on the backlog and stated, and I am paraphrasing here, no, the government have no plan. They are flying blind. They have no idea if they can clear the backlog or meet the inevitable challenges that are going to keep occurring as we move through this pandemic, because this government have no idea where the gaps in our workforce are, and they have no plan on how to fix it and fill the vacancies. So then what unions want, what workers deserve, and what people who rely on our health system need is a fully funded, fleshed out NHS workforce strategy produced with workers and their representatives, and a plan that the workforce, their representatives and organisations like health campaigns together can hold the government accountable to. backed up by the kind of investment that John talked about, that not only plugs the current vacancy gaps, but ensures NHS employers can retain the experienced, the expert staff that we already have. And the first step to doing that is to pay our NHS workforce a fair wage for a hard day's work, because the NHS workforce is the backbone of our health system. And if we want a strong and resilient NHS, we must have a strong and resilient workforce. Thank you.
Thank you so much, Shaun. Thank you for speaking so clearly and passionately. You're absolutely right. And I'd now like to hand over to the fantastic Gardner Mp, who is obviously Labour MP and long-standing campaigner for our NHS.
Thank you, Kat. Thank you, Sonia, for your amazing leadership. And thanks for inviting me tonight. The Health and Care Bill is the biggest threat to our NHS in its 74 years of life. Lorenzo, you were right. It was Labour that established the NHS, and it must be the Labour movement that defends it for future generations. The Tory bill will increase the rationing of healthcare and the postcode lottery for outcomes. Limited funding will be stretched to breaking point, and people in different areas will get different levels of care. And after the rationing, when the cash is gone, people will be left untreated by the state and forced to go private or suffer for years in pain and discomfort. That is why this bill is an attack on the most vulnerable. It puts big business at the heart of the NHS, where the decisions are made, where they decide what services they want and who should deliver them. That's why we tried to amend the bill so an integrated care board could not delegate its function or use its power to enter into an integrated care provider contract with any body other than a statutory NHS body. But the Tories are determined to put taxpayer money into the pockets of shareholders. A quick buck at our expense, just like with COVID. This bill is their new VIP route. John Lister and Helen said it all. It's the typical Tory strategy. Starve public services of money, reduce quality, and ignore the people as you hand the service over to your friends in the private sector. Look, as we're trying to recover from the COVID crisis, there's nothing in this bill to address the health inequalities that the pandemic has exposed. Our NHS staff are burnt out. Alison told us so eloquently. They're exhausted, they're running on empty, and yet still giving their all to the service that they love. We need action that would sort out the chronic workforce shortages and provide support to staff in exactly the way that Shaun has just said. Instead, the government is cutting resources, imposing a devastating reorganisation. It's going to do nothing to improve care or bring down waiting lists. As it stands, we've got over 6 million people waiting for an operation, millions more than under the last Labour government. And let's not forget mental health services so desperately in need of support, and nothing to improve cancer survival rates. The failures of the government go on and on. It's the wrong bill, it's the wrong time, and we must stop it now.
Thank you so much, Barry. Thank you for all the support for the NHS you've given us over the years, and also for the work you did to protect the NHS against trade deals when you're in the Shadow Cabinet. So thank you so much for that, and thank you for being with us today. So as many of the speakers have mentioned, we are opposed and campaigning against the outsourcing of our health services, because we know that not only is care compromised, but often their workers for the private companies are often paid poorly and denied basic rights. Now, the G4S porters and cleaners are protesting on January the 31st at 12 p.m. outside Croydon Hospital. Now, they are on poverty pay of £8.89 an hour, and they only get statutory sick pay even if they have COVID. So they're demanding occupational sick pay and the real London living wage of £11 an hour. So I hope all of you can get down there, join them on the picket line and show your support. It's really important. So that date, I'll just mention it again, it's January the 31st at 12 p.m. outside Croydon University Hospital. Now, our next speaker also needs no introduction. She is a fierce voice on the left. As an MP, I used to love watching her in Parliament because she just made all the Tory MPs tremble. And since leaving Parliament, she has continued to fight for progressive causes, and she is now the National Secretary of the People's Assembly Against Austerity. Laura, thanks so much for being with us.
Thank you so much, Sonia, and it's lovely to follow Barry. I know you probably hate it when people say this, and it might sound a bit sickly, but I really mean it from the bottom of my heart. It is like an absolute privilege to be on this panel with all of you. And yeah, I'm the National Secretary of the People's Assembly. This is such an important meeting because we have to form an effective and strong, passionate, unwavering opposition to every single thing that this government is doing and hold them to account for every single thing that they're doing. The national decisions that have really, really local impacts, the decimation of our social security system, meaning the explosion of food banks. People are hungry. You know, like we forget that really basic principle that people are sitting right now hungry with no food in their belly, no idea how they're going to feed their children, people in endemic poverty, because poverty pay is caused, and there is a correlation between the direct link of that poverty and the attack on our trade union movement, the right for members to collectively bargain. And the story of the NHS, I think, is a story of the system that we're up against. And of course, this is so emotive because so many of us have our very personal experiences, sometimes absolute joy within the NHS, and sometimes deep pain in the NHS if a loved one is sick, or of course if they die. But the beauty that exists in the care that all of you give is absolutely phenomenal. And if we think about the struggle to bring this system into being, think about the pain of working class people who were denied access to free healthcare at the point of delivery. Think about the beauty of bringing that system into being, where we collectively pay for services, essentially for strangers, on the principle that we don't want them, these strangers, we don't want them to feel pain. We want them to be healthy. We want a collectively healthy society, and we want rid of that pain. It really is the physical manifestation of love and solidarity, in my view, the NHS. And then think about how the capitalist class and the politicians who support them and uphold them see not the beauty of that collective wellness, but an opportunity to corrupt it for their own selfish profit. And slowly but surely, the interests of private capital have tightened their grip, haven't they, on this beautiful, beautiful system. And I suppose everybody in this call has really eloquently talked about the consequences of us moving further and further away from the founding principles of the NHS in the interests of capital. And it does mean less access to healthcare. We do know that, and it undoubtedly leads to more pain. So we have to formulate a plan against that. We can't just go, all right, well, we'll leave it to politicians, you know, we'll leave it to a kind of ordinary course of things. We, of course, have to agitate for anger against what is happening to the NHS and also every single other thing that is happening to us in this system. We must oppose the brutal attack on the NHS. And the People's Assembly have a really proud history over a decade now of opposing austerity. And I wanted to shamelessly exploit this meeting to say we want you all to join us in the People's Assembly, because from the 1st of May, and this is the first time we've ever talked about this publicly, but from the 1st of May, we are going to be moving to a membership organisation where you can join the People's Assembly. You can pay a monthly sub. It'll be all sorts of different rates. We'll have an annual conference where the members of the People's Assembly get to decide the strategic direction and campaigning activity of the organisation. We have a strategy for recruiting staff to be organising locally. Our aim is shamelessly to draw more working class people into our political opposition, to build a huge mass movement, which will of course be behind your aims, because our struggles are intertwined: austerity, anti-privatisation, building for what is could be a beautiful future, because we don't just want to oppose everything. We have ideas for how things could be different. So I really am like pleading with this meeting, if you like, that from the 1st of May, you can be a fully kind of paid up member of the People's Assembly, fully participating in the strategic direction of the organisation and building towards a mass opposition against this government. And I think if today's events in Parliament are anything to go by, we desperately need that. Thank you so much, Sonia.
Thank you, Laura. It's absolutely wonderful to have you on the panel and for you to remind us of the beauty of the NHS and what a civilised society actually looks like. I'd now like to introduce our next speaker, who is the brilliant Amelia Butt, who is the chair of NHS Staff Voices, and she's also a psychotherapist.
Thank you so much, Kat and Sonia, both for her chairing this event so well, and everybody who's joined on the panel, but also thank you everybody who's with us this evening. I want to start by dropping some not so fun facts. So recent figures show that in the NHS we now have a record number of 6 million people on hospital waiting lists. November figures show that we have more than 300,000 people waiting more than a year for routine care. And of course, we all know that A&E waiting times are at record highs. Now, these extended wait lists are partly a result of outsourcing to private healthcare providers. The answer, therefore, is not more private provision. However, this is the answer that the government is suggesting. What we do need, and thanks to everybody who's really spoken really well about this, what we do need is to invest in a properly funded, fully publicly owned NHS. And that includes the valuing of staff, many of whom are leaving their professions, not only because they don't have the financial incentives to stay, but because our jobs are being made so much harder and so much more overwhelming than they used to be, than they need to be, actually. So I was speaking to a doctor colleague of mine today who was telling me that more and more doctors are having to take leave after finishing their training, which is apparently a very new trend, but it's because it's all so traumatizing. Those are her words. She was telling me that someone she trained with many years ago left the profession entirely because it was just too much. The pay issue. Well, it's twofold really. Due to lack of secure contracts in the NHS, we see a huge staff turnover. So it's clear that staff are being failed, but this also inevitably impacts the patient care. In my service, we're getting more and more complaints because patients aren't getting consistency that they need. You know, in mental health services, people need consistency, and they're certainly not getting that. And that's a genuine complaint. We're also getting complaints that people are being offered 6 sessions of cognitive behavioural support, which doesn't treat the far deeper rooted issues that both young people and adults are presenting with. So I work with adults, and I also work in child and adolescent mental health services, which is CAMS. So in CAMS, we continue to see young people raising the stakes higher and higher to access support that they desperately need. And I mean, their risk is heightening. So in a discussion, a recent discussion with the team that sort of thinks about where young people are going to get the support from which team, we realised the really sad fact that though this person is currently more suitable for one particular team, one pathway, the waiting list is so long that by the time they get seen, they're likely to escalate and end up being allocated to the team that I work on, which manages far higher risk and far higher complexity. So this is what we're dealing with, and this is what young people are dealing with. They're being left untreated, and I mean therapy, not just medication, and they're struggling far more. And this, of course, impacts families and communities across the board. So private healthcare providers, they have been helping us reduce wait times, but they are also the reason that we need this help. In a discussion recently, Ian Wilson, who's a nurse colleague of mine, he put it really well when he said, private provisions do not reduce demand, they reduce supply. They take resources away from the NHS, and they're now offering this back to us for a hefty chunk of taxpayer money, and that goes into their coffers. It doesn't come back it doesn't get recycled into the NHS. So at the end of the day, the underfunding, the undervaluing of the NHS and its staff impacts the care and consideration given to our wonderful patients. We really must acknowledge, more pertinently actually, the very clear relationship between these two groups of people, the millions that rely on the NHS and the NHS staff, both of which are being failed by a government that continues to devalue and destroy the NHS. We've really got to act now or risk losing the capacity for a free healthcare for all that need it, despite it being despite a publicly funded and publicly owned NHS being the most financially and ethically sensible way of providing healthcare to the masses. Thanks so much.
Thank you so much, Alia. And I'd urge if there's any health workers on this call, please do join NHS Staff Voices and get involved in campaigning. So next up, we have Amelia Warmack from the Green Party. She's a deputy leader of the Green Party, and she is co-chair of the People's Assembly. And I just, as Laura said about People's Assembly, it was going to a People's Assembly event where I became politicised. So I would really encourage you to go along. As Laura said, a People's Assembly is a brilliant way to get involved in organising and bringing about progressive change. And so take it away, Amelia. Thanks so much for being with us.
Oh, thank you so much. It is a pleasure to be here today, not only to hear such incredible, strong and powerful voices, but also to see the over 500 people who have been here tonight, because we know it's by collaborating, working together and standing in solidarity that we can win. We will keep fighting together for the basic principles of the NHS and social care. For 74 years, the NHS service has provided first-rate healthcare to British people free at the point of access. Day after day, on doorsteps across the country, I hear about the pride that people feel for the NHS. This year has been like no other for the outpouring of affection for the staff and workers and all of those who work in health and care, who time after time put the lives of others ahead of their own needs. At the same time, we are seeing this toxic government champion a destructive health and social care bill, a bill that fails to address widespread staffing crisis that has been exacerbated by COVID and Brexit, fails to recognise that NHS and social care staff are on their knees, overworked and underpaid, fails the millions of patients who are on long waiting lists, many of them requiring urgent health and care needs. And on top of that, it misses the vital opportunity to bring privatised services back into the NHS where they belong. Quite simply, this is a power grab by the Secretary of State. And now the people we clapped for, and now the people we must fight for. Because make no mistake, the NHS is under attack. Tory cuts have seriously undermined our health and social care services, not just with this bill, but with a decade of their power. Waiting times are longer, hospitals are being downgraded, staff are under strain, yet we're seeing this bill that will see money helping line the pockets of private companies and give them a seat of power at the table. Because who can trust a government that gives PPE contracts that benefit their friends and family and whose chaotic actions generate headlines of lies and sleaze? I'm frankly sick of having to fight to retain the NHS, because I want to fight for a better NHS, an NHS where there's money to invest in its future. There's money to ensure that we have health and social care free and in public hands for our generation and for generations to come, to abolish prescriptions charges in England, to reintroduce free eye tests and give NHS dental treatment for all. There's money to expand free social care that NHS Scotland provides to the rest of the country, which, by the way, would create 120,000 jobs. to ensure mental health has parity and social care is genuinely integrated in a way that gives joined up services. We don't need to cut costs, and we certainly do not need to privatise. And we don't need to sacrifice the NHS on a failed altar of austerity. We don't need to subsidise the insatiable greed of corporate Britain by handing over our health service piece by piece. We oppose any attempts to create a two-tier services because the quality of your care should not depend on the depth of your pocket. Not now, not ever. We're not consumers, we're not shoppers, we are citizens and we are people. And if the pandemic proved anything, it's that it's people and not profit that drives this country. And it's the everyday heroes in health, the NHS, and in social care. They care for us. And today, by being here, we are showing that we care for them. Today, we must promise not to stay silent, to ensure that people know that they need to protect our vital services. So today, remember your own power and that every one of us must take action. Speak out, share this event on social media, sign the petition, write to your MP, and ensure that we use everything in our democratic power to say that the NHS is ours and we will stop this bill now. Solidarity to you all, and together we can win.
Thank you, Amelia, for that vision and for reminding us to take action now, and how important people power is. Just another reminder, do go to the website sosnhs.org, look at the section what you can do, sign the petition, donate, take action. And I'd now like to introduce Dr. David Wrigley, who is the Deputy Chair of the British Medical Association, who've been doing a fantastic job at standing up against the Health and Care Bill. They've come out really strongly against it, saying it's the wrong bill at the wrong time. Dr. Wrigley is also a GP in North Lancashire.
Thank you, Kat, and it's a real privilege to be here tonight speaking to you. I'm David Wrigley, I'm a GP in North Lancashire, as Kat said. I'm Deputy Chair at the BMA. We're the Doctors' Trade Union. We've got over 160,000 members. We're the voice of UK doctors, and we've consistently spoken out and challenged government, particularly during the pandemic. You know, we've tackled on the woeful lack of PPE, the outsourcing of contracts for PPE and test and trace, the huge burnout we're seeing amongst doctors and the mental health strains that they face, and the impact of the pandemic on our BAME colleagues. And it was the BMA actually that first called out that the first 10 doctors to die in the pandemic, tragically die, were from BAME background, and we forced the government to investigate this. Now, I want to just talk a little bit about the NHS before the COVID crisis. It was in a mess then because of political decisions. The NHS was underfunded. The UK spent about £20–30 billion less per year than leading EU nations. The NHS is underbedded. We have 1/3 of the number of beds in France per population, 1/4 of the number of beds compared to Germany. Germany works at about 85% bed capacity. So they've got the ability to flex during the pandemic. We work at 95–100%, possibly even higher than 100%, because patients now, many patients sadly are on trolleys in corridors waiting for care. So we don't have the capacity. And that's because we're underbedded. We're also under-doctored. We've got one doctor for every 360 patients in the UK, where the EU average is one for every 288 patients. And we're also under-equipped. You know, the equipment we have is not adequate. In a recent study by the OECD, England ranked lowest amongst 23 countries for the number of CT scanners and third lowest for MRI scanners, vital equipment to diagnose problems. So we've now got a massive backlog of care. Over 6 million people are on waiting lists for investigations. Every one of them is a patient waiting for an operation, for a scan, maybe unable to work or care for a loved one. You know, and this is not the fault of the NHS staff. It's not the fault of our NHS. That staff are going above and beyond. They're always doing more. The NHS is propped up on goodwill. And we hear fine words from politicians, but we need action. We need fair pay for the frontline staff. We need huge investment in equipment and premises, and we need to look after our staff. You know, the NHS is not good at looking after its staff. So during the pandemic, you know, the UK now has had the highest levels of COVID cases compared to other EU nations. We've got increased levels of hospitalizations, twice as many at times and 4 times the level in France. And the death rates have been amongst the highest compared to many similar nations. And this is not, again, the NHS is trying its hardest, but politicians making decisions like today, where we see restrictions eased for political reasons, when they should be still in place to protect the population and protect the staff. And just one word on the vaccines. The vaccine campaign has been a huge success. And that's not because of the politicians or management consultants. That's because of the amazing NHS staff, our amazing volunteers in our communities. I led our vaccine campaign in North Lancashire, and it's just been phenomenal to see the response of the NHS staff all pulling together, the NHS management and the volunteers. Wonderful to see. Just a word on the Health and Care Bill. The BMA opposes the Health and Care Bill. I'm leading the campaign on this. We've done a huge amount. We want to stop private companies sitting on these commissioning boards. We want to stop handing more powers to the Secretary of State. We want to make politicians more accountable for workforce numbers. And we want to give grassroots clinicians a bigger say in choices made for patients. So we've said this is a wrong bill at the wrong time, as Kat said. And if you just Google BMA Health Bill, you'll see all that we're doing. You can take part, help and support, and we'll address some of the problems that the NHS faces. We've got a government pushing this through during a pandemic, completely the wrong time to do this. And finally, just want to spare a thought for the well-being of the workforce who've gone through a dreadful time this last few years. The impact on health and well-being has been immense. We've undertaken monthly member surveys. We had 15,000 doctors replied in 36 hours to one of our surveys, very quick snap survey. 6 out of 10 doctors said they're now suffering some form of anxiety or depression. And half of them were saying that had worsened since the start of the pandemic. Huge problems that we're facing. The BMA's there, we've got support and help, but we have to look after our staff. So thank you for all that you're doing. It's been a real delight to speak to you tonight. Keep speaking out, keep campaigning, stand up for our amazing NHS. We want it to be publicly provided, publicly supported and funded. Thank you to the staff and our patients, and all the best for your campaign.
Thank you so much, David, and thanks so much for all the work you've done for so many years with the BMA. And I think the BMA has really been so brilliant, particularly in the past few years and with COVID. The BMA has been amazing, not just supporting doctors, but also getting the politics right and raising issues around the NHS. So thank you for that and your leadership there. Now, I just want to give a shout out to the security workers at Great Ormond Street Hospital. Now, some of you may know, but they are denied the same annual leave, sick leave and career progression as other NHS workers at Great Ormond Street. So they're fighting for equal rights and against race discrimination. The workers who are predominantly Black, Brown and migrant are being denied the same terms and conditions as the other predominantly white NHS staff at Great Ormond Street. So they're demanding the same basic rights such as sick and injury pay, annual leave, enhanced maternity cover, overtime and pension contributions. Now, the security guards are the only workers at Great Ormond Street who did not get full sick pay, even during the global pandemic. So the security guards have been asking Great Ormond Street bosses to end this unjust disparity and bring them in-house for the past few months, but there's been no response from the bosses at Great Ormond Street. So they are going on strike from 3rd of February for 6 weeks. And this is set to be one of the longest strikes in NHS history. So we need to support them. Please get down to the picket line. It's going to be from the 3rd of February. Please show them the support. This is a really important campaign and we need to support them. Now to our last speaker and another, I feel like I'm being a bit repetitive here. I'm going to say another giant of the trade union movement, but I think we do really have on this call all the big dogs from the trade union movement. So we're very lucky. So our next speaker is a former NHS nurse, and she is now the NHS organizer for GMB Union. I'm sure you all know her. It's the brilliant Helen O'Connor. Over to you, Helen.
Thank you very much, Sonia, and thank you for inviting to speak. And I'll start by saying what everybody said tonight, that we must have an uncompromising opposition to the private sector taking over the NHS. They run services into the ground, they abuse and they exploit the outsourced workers. And privatisation means workers are no longer treated like they're part of the NHS family. Once they're transferred out, they're forgotten about. These companies drive down their wages, terms, conditions. They're bullied daily by managers. Their dignity, their lives, their health and peace of mind ends up utterly destroyed. And let's remember, there's no NHS services without the ancillary staff. Not a patient would move, no one would be fed, nothing would be cleaned without the labour power of the outsourced workers, and the hospitals would grind to a halt. The G4S workers in Croydon don't choose to come into work when they're sick, but they can't live on the statutory sick pay either. So they're between a rock and a hard place. These workers are demanding full occupational sick pay and the London living wage of £11.05 an hour. Both G4S and Croydon NHS are ignoring their demands because private profit is being put before the welfare of human beings once again. The Croydon G4S workers, however, aren't going to put up with this abuse any longer. They're learning from the example of the other NHS outsourced workers who've taken on these big companies and won big gains in pay terms and conditions. And yesterday, the GMB union bin workers won a huge victory and a 19% pay rise. So what lessons do we draw from this? No matter how big and powerful an employer seems, when workers stick together in their unions, they campaign hard, they take industrial action, they can win. Let's always remember, campaigning works and action gets results. The G4S workers in Croydon have decided to stand together and fight back. They're joining GMB in large numbers and getting organised, and they're going to kick off their dispute with a protest outside Croydon University Hospital on Monday, the 31st of January from 12 p.m. And I'm asking for full solidarity and support for these brave GMB members. And let's remember that workers like this aren't just fighting for themselves, they're fighting for all of us, for patients too, and they're taking huge risks. And these workers are telling me that they want an absolute end to privatisation of the NHS, and they want to be back in-house on NHS pay terms and conditions. And let's never forget, privatisation is the organised, legalised theft of our public assets. Anyone, and I mean anyone who supports privatisation, who advocates for private companies to be bought to operate in the NHS, or for private investment to be bought into the NHS, or for private health companies to take over health to provide health services, is no friend of the Labour and the trade union movement. The truth is, and we all know what's required and what we need to do, and that is to organise widely, deeply in communities, in trade unions, to defend a publicly owned national health service with well-trained, properly paid staff, properly financed and dedicated to public health and not private profit. Thank you very much.
Thank you, Helen. What a brilliant note to end on, reminding us of how we can win and what is at stake. And thank you so much to all of our speakers and to everyone who organised this rally, and to all of you for being here. We've had around 500 people on this call. That's a wonderful turnout, and it's just been a really brilliant meeting. I want to just say a couple of things before we close. This campaign, this SOS campaign, is really specific, as has been talked about. The goals are to get emergency funding of £20 billion to save lives this winter, to invest in a fully publicly owned NHS and guarantee free healthcare for future generations, and to pay staff properly. It's got the backing of nearly 40 campaigns and unions, and it's really clear what we want to achieve. So please do go to the website, please do sign the petition, please make a donation if you can. Please save the date of the National Day of Action on Saturday, the 26th of February. Let's get out on the streets, into town centres, every campaign group in the country. And let's also bear in mind the date of the budget, the 23rd of March, because that's the date we should be getting the extra £20 billion. And let's make that our rallying call, that we want £20 billion and we want it now. It can't wait. Thank you again for taking the time to be here. We really appreciate you giving your energy to this campaign, and let's win it.